All right, welcome back, everybody. I love the energy in the room, and we're certainly going to have a little bit more time during lunch to kind of collaborate uh, and chat about our plans. So, as we want to show that, we kind of adjusted the agenda a little bit. This hour, we're going to talk a little bit more about nutrition and climate change curriculum. So, just a short 10-minute discussion, and then we'll be followed by school updates and challenges from many of our student leaders and faculty leaders. And then just to show you the end of the agenda, we'll have a lunch meeting, and then we'll have a little bit more discussion about the work in climate change and health curriculum, and we hope to adjourn shortly after. So I want to open up the floor and introduce Dr. Shirley Kawani. She's the Director of Graduate Medical Education at the Innova Health System. As her trade in her work is a hospitalist like myself, but she has a special interest and expertise in endocrine consult service, serving as a diabetologist. She has also had a long history of being an education leader. She was a transitional year residency program director as well many years ago. She got her training at George Washington University School of Medicine for her internal medicine residency, and got her medical degree at the Chicago Medical School at Rosalind Franklin University. So, Dr. Kawani, you want to give the floor to you to chat, so they can actually see you anywhere.
Oh, okay.
Yeah.
Do you want me to stand there?
No, you can video.
Okay, great. Hi, everyone. Nice to see everyone from last night too, that we all met last night at the dinner. I'm very excited to be part of VCCA, the educational committee. I'm a member with the leaders here. And it's been very enlightening. I joined this year. So my background is, like Holman had said, Dr. White said, that is in diabetology. I'm an inpatient diabetologist. What that means is I co-manage patients with surgeons that have diabetes, new diabetes, and coronary disease. And so over time, over the last decade or so, I have been very interested in preventative medicine, specifically on the nutritional side. And because I went to, because of medical school, and my only background for medical school and residency did not include any nutritional training, which is shocking to most people. But all of us here, I think, did not get much nutrition training, dietary training. I was unable to even counsel my patients on this, and I would refer them to very limited resources. And so that's where I decided to take my journey, learn about nutrition myself. And through that journey, I learned about our food systems and its contribution to our environment, and specifically climate change, pollution, and also biodiversity loss and everything. So a lot of people, and I'm just going to give just a brief thing, because I'm sure some of you or most of you have heard about food systems and its relationship to climate change, but a lot have not. And I think it's an essential component to when we talk about climate change mitigation. So our food systems actually contribute a lot in terms of greenhouse gases in many ways. And specifically, we focus on, when we talk about animal agriculture, methane, also carbon dioxide, but also methane release. And the reason we want to focus on methane is because it depends on what you read, but it's at least 80% more potent, methane gas, as a greenhouse gas than carbon dioxide. And actually, it has a shorter half-life than carbon dioxide. It's about in the atmosphere for about 10 to 12 years, depending on what you read, which is good news for us. It's potent, but then also shorter acting. So any changes we make in that release can have significant impacts. Whereas, carbon dioxide could stay in for, 100 years, okay, in the atmosphere. So it's hard to change it. So I feel it is essential, I think, people in the medical field to focus a little bit on food systems, because it is also very important to health. We want to counsel our patients on the best dietary patterns for their health. And again, that's where my background comes in for diabetes and other metabolic health diseases. And so I try to marry both. It's really the food sustainability systems is good for population health and also for planetary health. Okay, so I would like to, through VCCA, I would like to start our food sustainability and nutrition committee. There are many people who are interested in joining, either because they want to learn or they want to advocate for this. And I think it would be a good position to do that, especially as we start, initiating as a nonprofit. And so I'm going to share, Toman will share my email. I think we're going to try to put something together by the summer. And anyone who's interested in joining the committee would be great. Now, let me just tell you, I think our focus will be, of course, in terms of healthcare systems, I think, and the community, educating people on those systems related to dietary patterns too. I think it's a win-win situation where we can do both. I think also for medical learners, it's very important. Farrah's here in the audience. She and I and another student and another faculty member are developing a curriculum for the medical students that can be applied to all medical learners, actually. And so anyone who wants to contribute to that as well would be great. And I think, this is our journey. So I think if we can add this to sort of the initiatives at VCCA, it would be great. Okay. So please let me know if anyone is interested or have any suggestions. Advocacy is, of course, a big thing. I could go on, and I'm happy to give a lecture or didactic for anyone in this area, because the Farm Bill is something we actually wrote a statement for recently. And that's $1 trillion bill that includes nutritional practices. And we have to think about food insecurity as part of it. But advocacy is a big part of it. Okay. Any questions?
So we have, nursing students and also medical students here. What do you guys see in terms of the, teaching of nutrition in general in your curriculum so far? And then what do you see there may be opportunities in your own respective institution?
Yes.
Well, I will tell you, Beth Tremblay, Old Dominion University School of Nursing. I teach in the undergraduate department. So I have the new nurses who are becoming BSNs. And I absolutely love what you're saying, because this is a huge push, because as we're having all these climatary changes, it's so there's this importance of climate mitigation, climate change mitigation, but in so many ways, there's only so much that we're going to be able to do.
Yeah.
And we have to have a huge focus on that, but we need to help people start understanding how to live through climate change. And one of the things we see, especially around the area of ODU, is a very high rate of food insecurity.
Yes.
And so we have to really think about how to help people not just have food, but high quality food in a sustainable way. And food banking is not a solution. It's an emergency measure. So I love that you brought up the Farm Bill, a big advocate for SNAP.
Yes.
For helping people connect with SNAP.
Yeah.
All of my students learn how to fill out a SNAP application in class so they can go out and do those sorts of things.
Yeah.
But also there's such a tie-in with climate and food quality. I'll be on your committee.
Yeah.
Please, I'm losing my words because I have too much to say about it.
Yeah, well, I didn't get into it because we get into we could go down a rabbit hole, but there's wonderful, food is medicine initiatives.
It is, yeah.
Which can sort of bridge that gap that you're talking about. And I think that's where we need to go. And we need our government subsidies to go towards that, and also sustainable agriculture. Yeah. There's so much to do. So as a committee, we could really recommend a lot and advocate for those changes. So absolutely, there's a lot to do. And I agree with you. It's not about just giving people a referral to a food bank or food pantry.
Right.
It's not about that. We want sustainable change.
Yeah.
And again, the key to it is, because we're in healthcare, it's really these nutritional changes are good for the planet, they're good for patients, they're good for all of us. And it has also food waste and everything. So we can go on, but please join. That would be great.
Yeah.
Yeah. I don't want to take it too. Yes, go ahead.
One thing that I do in my practice, I serve all underprivileged, really.
Yeah.
And I have a garden that the patients manage in my office.
Oh.
So, because they don't think it's possible. And so what we do is through the seedlings, I kind of manage it. And then when they come in for their appointments, I'm checking on their babies. Some of them don't do well, so I kind of put some other stuff in there, but, because they don't think that it's possible. They think gardening and growing your own food is something that other people do.
Yeah,
And so when I said, yeah, I have a garden, they're like, garden, like, yeah. And so they're actually interested in it and they want to take it home and they want to take it home and to grow it and they're telling people about it. So people will come in and say, I heard you had a garden. And I'm like, well, the patients have a garden.
yeah.
Can't do it for the organization, but I can do it in my office, whatever I want. And so they do like it. And so I think if more people had support
Yeah,
and understanding
training
the opportunity.
skills.
I said, you can get 500 little seeds for $3.
Yeah.
But if you go with $3 to the store, you're gonna get half of a tomato.
Food seeds?
Yeah.
Food seeds? For myself.
So there's ways that you can get it for free, grow it for
Yeah.
yourself.
Mhm.
Even if you just have a small balcony in your backyard, there's things that we could do that help people, really feel like they can be part of it, because we're running out of food,
Yes.
or we're running out of money.
Or soil.
Well, yeah, I mean, the other thing is that, we could go again, the agriculture that we have, we don't have enough habitable land for agriculture to feed basically, the world, but we have so much land in terms of people's backyards. There's certain areas for community gardens. So yes, absolutely, that is a
gardens.
solution. Yeah, even on, exactly. So people just don't have the knowledge and skills. And so that could be a huge component of it, is help people become self-reliant and able to grow and produce, healthy food that's also better for all of us. So yes, please join. Because I'd love to hear about that experience and how we can scale it up for people. Definitely. Yes.
Shirley, I'm just gonna ask, in such a big, necessary, interconnected system when it comes to food, do you find a better connection point to be kind of personal choice, education about someone's diet, healthier choices for planet or themselves? Or does that feel so small and inconsequential towards the larger issue that you have to bring in larger, factory farming, the farm bill, bigger kind of change mechanisms in order to grab people's interests? I'm just curious which of those angles
Yeah.
people tend to gravitate.
Yes, so it's an excellent question. We were discussing this last night, actually. So it depends. It depends on the audience. So I think for patients, the diet is very important. It is essential for people to understand what a healthy dietary pattern is to prevent cardiometabolic disease, period. I think that's a very important part. The medical community does not do enough. If we do touch upon it, it is just in one time. It needs constant counseling. We need to have a system in place so we can go back to it to help people and support their families for this. It is a huge behavioral change for most people. And people, again, have issues, barriers we don't even incorporate, like social determinants of health. We talked about food insecurity. So it depends on that. So I think for patients and people who have disease, we have to focus on dietary plans and think about the impact. Everyone has to eat 3 times a day. And we focus on it. You don't get me started, but we focus on exercise. But it's a small component of cardiometabolic health. It's important, okay, and more so we should move. It's not about you need to go to the gym and work. So, but diet is so important that we don't get into. And so I think for patients, we definitely have to focus on that. I think for younger people or people who are just wanting to make a contribution, we talk about planetary health. So it just depends. And then again, for patients, it depends on the age too. So I've tried everything, and I have a whole series of lectures and didactics for that. But I think that dietary patterns, dietary change, because we all have to eat every day, can have huge impacts. Even if I talk to primary care physicians that are in clinic, if they counsel each patient a little bit and get them to change 1, 2, 3 meals a week, it would have huge impacts on the clinic, really. So I think we don't take that into consideration enough. Yes.
I think we were talking this morning about how going to community leaders to kind of get the message out about anything.
Yeah.
Kind of helps to impact who takes it in and who doesn't.
Yeah.
Like currently, so I'm part of the Baptist Convention, and so currently we have a garden for our churches. We have a garden that we give out stuff to. or to our patrons too. And oddly enough, there's a lot of people that are like, I don't want to take it. They don't want the fresh fruits and vegetables, but
Yeah.
it's because they don't understand that this means that you will be
Yes.
healthier. This means that it'll help. So if we kind of collaborate, the providers
Yeah.
as well as the community leaders, then it would help them to understand what they need. The only time we get people to take stuff is when we have collard greens at Thanksgiving, or you know what I mean? Like,
Yeah. So I think there's definitely, there's education is very important at the base. It's not, so also culinary medicine, people don't know how to prepare food. You know, people just really don't know how to take this food and prepare it, but they don't even know what the nutrient value is. They don't understand about fiber. I mean, this is all the stuff I had to teach myself. And so we need to teach others about that. And we also need to also model behavior. I think that we need to also practice what we preach. That's a hard one. I mean, that's what I'm trying to do with medical learners, physicians. I'm trying to sort of teach them about the benefits, because some of them also are patients as well. But if we embody that behavior, we're more likely to advocate for our patients. And also understanding processed food. What is that? How do we get away from that? So there's so much we can do. And you just go down these sort of holes about how do we make an impact for patient and planetary health. But yes, that's one thing too, is that how do we provide education to patients who even come at the point of care to get those vegetables or change their diet.
I just think a lot of people don't have providers, and
Yes, they
The-
don't have, right.
yeah, the message has to come out somewhere. People go to church, people go to the grocery store,
Yeah,
like,
community in the
Community.
community. Yeah, and that's what we need to talk about. Like, where can we meet patients and educate them? Just like we have health fairs, we should be able to go out there and just have nutrition fairs or whatever you want to call it, food fairs. But we should talk to people about also going back to cultural dietary patterns, like menus and traditional menus. We have to do it with cultural humility. Traditional menus actually were very healthy. And we've gotten away from that. So we need to also bring that back to say, this is relevant and we could meet this. Yes.
Hi, I'm Mariel, the OD nursing undergrad student. In regards to like the SNAP benefits and things like that, could pamphlets be given out? Because my mom used to work for social services. She's a nurse as well.
Yeah.
And they kind of covered like resources and where to get fresh foods and things like that. So could pamphlets with kind of like dietary alternatives be beneficial for that? Because, a lot of America is really big on sweets and meats, and that is, those are two main things that cause a lot of health issues. So
Yeah.
just, dietary alternatives, like for example, like lasagna, maybe you use vegetables instead of meat, or maybe you use more lean meats instead of like pork and things like that are high in sodium. So what would that kind of look like to incorporate or educate on dietary alternatives?
Yeah, it's a great question. I think you have to start. So pamphlets are one thing, but I think people have to understand again, if we're going to switch over, it's all about replacement. So you're right. So you can give people an idea of how one dietary pattern, basically the standard American diet, is not really helping anybody right now. And we need to crowd out with healthier foods. And then what does that mean? And not push this on them, but sort of figure out what do they enjoy already and how can we crowd it out more? And how can we get to really adopting whole foods, not processed food? Because there's so many misconceptions about keto diet versus, which is a severely low carbohydrate diet, which is actually not healthy. So there's so many things that we have to combat a lot of myths as well as giving them information on that. So I think it's both. Okay, I'm sorry, I'm taking so much.
Thank you, Shirley. Obviously,
Makes a good
everybody could talk about food all day long.
Yeah.
And it's why I went into gastroenterology, so I can start talking about food. But we're gonna get. Thank you, Shirley.
Yeah.
I'm good at filming.
Okay, perfect.
We're gonna now have updates from the different schools, and so thank you for being patient. I think Vishnu. I haven't met you before, but nice meeting you. And
Nice to meet you
you're gonna,
too.
for giving an update on your busy schedule today for VCU. So we're just going to have brief updates from a number of schools today and how they're doing with climate and health in the curriculum.
Yeah. All right. Hi, everyone. I'm Vishnu Alavala, and I'm here on behalf of VCU to talk about what we currently have going on in terms of climate advocacy and interventions in a medical context. And I'm a current second year student at VCU, well, rising third year now. And I just wanted to preface this because there's a lot of things on the medical campus that were previously initiated that I believe are no longer active that I'm not familiar with. So any questions that you guys have, I might field you to someone else who's more established at the medical school. But if I'll go ahead and share my screen so you can see it. Okay. So I currently am the president of the Medical Innovation and Sustainability Society, and this is a relatively new club that we started last year that's looking at promoting this intersection of sustainability and medicine and innovation. And we've been trying to get more individuals to join our club because one of the biggest concerns is everyone sees the club and thinks of it as just like a medicine only field when we're really trying to get that diversity of perspective and viewpoints. So we're really trying to branch out a little bit more in the coming semesters, but we've planned on looking at different research projects, such as how to decrease the amount of waste in dialysis, and also help advocate for better practices with anesthesia and other types of gases in the medical facility, in addition to just doing regular advocacy and lobbying efforts and raising awareness. So this is great. This is a wonderful event for me to learn more and better understand where we should be focusing our attention on for the coming year. So I wanted to focus on just like some aspects of VCU, and this is kind of like pulling from the Planetary Health Report Card. They have had one updated every year at VCU, but I've tried to contact the person in charge of initiating that, and I haven't been able to reach out to them yet. I haven't heard back anything from my email, so I might just keep at it because I really want to get more involved with what research is being done and how we're doing those surveys. So right now we don't have a health education elective. We don't have planetary health topics are really not covered in the core curriculum for the medical school either, and they're not really covered in depth, and there's no electives currently offered at VCU. There is an interdisciplinary global health elective, but I don't think that it has the same focus on climate and that thread of thinking about the environment and our place in it as much as it should. And I think we should definitely talk about updating the curriculum. I loved hearing that our previous speaker was looking at initiating like some sort of curriculum. So I would love to talk more about that. Right now, ours is the only student group or professional interest group. There used to be an MS4 for SF chapter, but it's no longer active at the medical school. So I'm also trying to work with individuals there to get that restarted. For our next steps, we do want to, again, create that interest group and talk more with the sustainability committee. We started this one VCU plan, which has sustainability as one of its main tenets. But the problem with this plan is that there isn't much information about really anything that will be implemented in the future. There's no timeline. It's more of just like a set of guidelines and recommendations. And we actually had our club members in conjunction with Green Action, which is a more general health-related and sustainability-related organization on campus, read through this plan and give detailed recommendations just to be more transparent about data and waste management. And we wanted to also look at how like lab spaces are prioritizing sustainability, because currently there are no initiatives to help decrease energy use or improve water consumption, or really to more effectively or efficiently recycle and handle waste, because VCU takes pride in being like a R1 research institution, and yet we don't have any of these implemented anywhere. We also want to push for obtaining membership in like programs that help implement these practices for us. Because right now, the One Sustainability Plan is run by a bunch of teachers and professors who are volunteering their time. And so there isn't really much initiative for them to go the extra mile sometimes. And I think that having like professionals and experts that we can refer to is something that we should work towards at VCU. Again, like divestment is another huge issue that we haven't really touched upon in this plan either. It offers a form for students to give input, but again, like I filled that out at least 5 times, and a lot of my club members have been filling it out as we get more information, and we haven't really seen any feedback from that. So we did actually make a petition, and we have had, I think, over 100 people sign it, which has been really great. Again, this happened before the One Sustainability Plan was released, so hopefully it had some sort of say in promoting that. And this is linked. I'm not sure if you guys are going to get the slides, but if you did want to take a look and just see the statistics that we pulled to help support these claims. We do have like more recommendations, especially looking at more specific actionable items instead of more general trends that are like VCU research should decrease waste, and instead being more specific and saying like this one specific location in the hospital should have more apparent recycling bins and things like that. So we offered a bunch of those, and here's the report card. Just other brief things that I haven't touched upon yet. In terms of research, there are some professors in the chemistry department who are looking at research, and like researchers who are also students can choose their topics. So if anyone were more interested in looking at that, they would be able to. Like, for example, I'm working on how like ozone pollution affects fetal neurodevelopment. So just like individual students, but there's no like set research group that's like advocating for these things. And there's also like a sustainability committee and a pharmacy organization, but it doesn't really have a lot of faculty or peer support. So we have like a lot of things to work towards. And so this is just like a timeline that I set up for our club to try and work towards these things, and potentially have more guest speakers come in, more faculty, have a personal stake in this matter, and just making sure that we're doing events that make our student body also more interested in these issues. We do want to help the VCU One Sustainability Plan create this elective with the educational track, but I think that will be a more long-term goal. All right, thank you so much for listening, and this is my contact information if anyone is interested, and please show your support if you have Instagram.
Vishnu, thank you so much. And you highlighted one of the issues of sustainability that we haven't really talked about, and that's sustainability of keeping a program going at an institution, because students transition out, and a lot of the students like you have had a large passion and expend a large amount of energy getting all this stuff done. And then when you graduate, there's a void often. And so what we want to do is try to figure out the continuity there. And so we'll talk about that a little bit later, but VCCA, part of our goal is to help institutions sustain that sustainability, sustain that initiative, sustain that interest, and create a permanent sort of record like they did at the institutions we saw before. So Farah, I'd like you to come up. Farah's a rising third-year student, is that right? Or
No, I'm actually fourth year.
fourth-year student at
I know
UVA. And
Michelle, you're in 3rd year. Yeah. Wonderful.
Oh, the slides are they?
Yep, they are on the.
Thank you so much, everyone. I do have to drop out, but it was really wonderful hearing from everyone.
So much, Vishnu. We'll definitely be in touch.
Everyone, I'm Sarah Contractor. I'm a fourth year at UVA.
Yeah, I'm Vish already. I'm a third year at EPA.
As you can see, one of our other members, Nick Underwood, he wasn't able to be here today. But yeah, this is our update. Let me see if I can get it to work. There we go. Okay, so the Student Clinicians for Climate Action at UVA started in 2020. Our founder, Lena Schell, did a Hook Scholar project. The Hook Scholar program is a program through the Center of Health and Humanities and Ethics at UVA. And so it's this like ethics program or health humanities program that 5 medical students a year participate in and do some sort of like humanities-based project. It can be advocacy, research. Lena chose to start the Student Clinicians for Climate Action. Yeah, as you can see, our aim to like examine the role of the environment, particularly a changing climate on human healthcare. So that's how we became a school medicine organization as well as a UVA organization. And we've amassed around 80 members in our organization from the School of Medicine. From the School of Nursing, we kind of like fell off the School of Nursing a little bit. So yes, thank you. Yeah, we had some amazing leaders in the School of Nursing who graduated and then transitioning, like we just talked about, was kind of difficult. But we have 14 exec board members and then 11 people who participated in drafting and completing the 2023 to 2024 PHRC. And so this is some of us. These are mainly the PHRC or the Planetary Health Report Card. And then, so I can briefly talk about the Planetary Health Report Card. You can kind of see our, but you can't see our.
Feel free to minimize.
All right.
So just pick the.
So far, yeah, far right
Yeah.
there.
Okay, there we go. Yeah, so you can see in terms of curriculum, we had a pretty significant positive trajectory from a D- in 2021 to a B- in 2024.
Right.
Yeah. Discuss some of how like we got from a D- to a B- during this presentation. And so you can see us for number 11 amongst the medical schools, at least in the US, that are ranked up here. And at least the PHRC, since we started it, has grown significantly in terms of like going to international locations. So you can see all over the map where folks are located who are doing this report card.
Yeah, so I'm gonna talk a little bit about kind of the stuff we did in the curriculum department in order to get from a D to a B-. So one thing is that we now have a curricular thread. And what that means is we have interspersed lectures throughout our whole curriculum from first year to fourth year. And these lectures talk about stuff like the way that climate change is affecting health in America and across the world, and how diet is important. All sorts. I'm still only halfway through, so I haven't seen some of the stuff that's yet to come, but the thread extends from first year to fourth year. And now there's also honor exams. There's a couple questions about climate health and climate change and how that's changing. I think that's important to kind of expose that because medical students, especially if it's on an exam, then they care about it. So that's what's going on with the curricular thread. Oh, and then and then we also started an elective for fourth years at UPA, and it's like a month-long elective that anyone can participate in if they, a 2-week-long elective that anyone can participate in if they choose to. And then the other thing that I wanted to talk about is the student-run climate checkup podcast. So this is spearheaded by another student, Venkit, and essentially it's students that talk about issues in climate change and health. And they released 2 episodes so far about extreme heat and about asthma and how that's changing as climate change continues to take effect on the world. And this is for everybody, not just for medical professionals. So I just wanted to kind of plug that. If anyone has anyone interested in that, or if you guys are interested in that, please take a listen.
we're on Spotify, and, there's something else. Oh yeah, we're also on Instagram as well, but, yeah, we have like these nice infographics on our Instagram that kind of summarize each episode. So, I'll talk about the nutrition lecture that happened last year that Dr. Kalwani gave. It was pretty well attended on Zoom and in person. We had food there, and it was an amazing lecture on plant-based diets and sustainability. And now we're working on, like Dr. Kalwani mentioned, a fourth year elective that'll be probably 2 weeks on clinical nutrition. We do have a culinary medicine elective at UVA already for fourth years, and so that's kind of where you learn like the actual skills of making the food, but don't really have any sort of education on nutrition counseling and like talking about these issues with patients. And that's such an important part of becoming a physician, like at least a competent one who can talk about these things and guide their patients. And so, yeah, that's what we're working on. Hopefully we'll be done this year and have it ready for maybe next year. These are some of our past curriculum advancements. So Dr. Y has been giving, has been 2 years now for the Bedside to Community lecture. So this is for third years who are transitioning into fourth year, and it's kind of talking about climate change as it relates to yeah, like the clinical impact that it will have and how we can implement some of that knowledge in our fourth years as we become closer to becoming real doctors. And then the other lecture that has been given, I think for about 3 years now, the climate change and pulmonary disease lecture in first year curriculum. So this is by Dr. Alvin, and it's during the pulmonary system. So when we're learning about respiratory disease, she gives an actual like dedicated 1 hour lecture to climate change. So that has been a really nice advancement. And then we also have a picture of us at the third annual climate change and health elective course. As part of that course, Michelle mentioned it's a 2-week course, and fourth years can sign up, but anyone can go to VCCA Advocacy Day, which is why there's people from all different classes in this picture here. And VCCA Advocacy Day is like implemented as part of the course. So I think it's the last day of the course, right? Yeah, so that's a really nice way to tie in like everything you learn about climate change and climate health and actually talk to politicians about it. So some of our next steps, we want to have journal clubs. We've been talking about doing more journal clubs and collaborating with other like specialty interest groups at UVA. That's a pretty common thing where groups collaborate on like a specific article that touches on, you know, both interests. And so we're working on that right now. And then we want to do more podcast episodes. We're also, so some of the learning objectives that we talked about as part of the curriculum thread. So right now we have learning objectives for almost every single system in the curriculum except renal. And so we're working on some learning objectives for renal and trying to implement more of those. And maybe instead of pilot test questions, we'll have like real test questions for M1s integrated. And we're working on the clinical nutrition elective, and hopefully we'll get some more nursing students involved. And then there was one last thing that I forgot to put up that I wanted to mention too. Oh yes, a survey. So because of all of these things over the past couple of years being implemented into the curriculum, like we're not just seeing it, all of the med students who are going through this program are seeing it. And so we want to get folks' opinions on climate change education that we've started since around 2020. And we're trying to figure out a way to do that. We were thinking about doing a survey, like a class-wide survey for each of the 4 classes, but that kind of requires some IRB approval, and we're getting pushback. And so we're gonna brainstorm and think about that more too, just so we can get like a sense of, are we doing a good job? Yeah.
I just wanted to add for the climate change learning objectives. A lot of that is student driven and student led. So we have lectures where we'll collaborate and talk about what kind of things that we think is important to teach. And we did that last year when I did the renal system. And so I'm thinking that there'll be learning objectives for it for the students next year.
And here are some of our pictures of events that we've had, and yeah, I can, I guess, kind of describe some of them. So Convention, the Science Festival, is a fun festival that we have in the community geared towards younger kids and younger learners. And so we had some folks kind of make this interactive little like pool where kids were like picking up all the litter out of the pool and also learning about climate change along the way. And yeah, here's a picture of us outside, actually like volunteering in nature, which was really fun. We got to remove invasive plant species from some of the little baby trees that are growing around the area. And then, yeah, we had a medical center hour, which is a like kind of humanities event that's put on every single Wednesday, or it's maybe one Wednesday of the month for like the academic year. And we had our founder, Lena Schell, mediate a panel between two physicians who are passionate about climate health. So that was really cool. And yeah, we had a town hall in this top picture that was like kind of more COVID time. So we're all wearing masks, but yeah, thank you.
Thank you. And we'll take questions. If we have them.
Try to get out of there.
Stop share. So just thank you again, you two, for explaining what's going on at UVA. I want to give a shout out to Lena Bichelle because not only did she help create the curriculum while she was doing the Hook Scholarship, but I actually used that same, or the model of that curriculum to teach to health professionals at Shenandoah University. So she's had a global effect. She's now a pediatric resident at UVA. So she's still in the area and but quite busy. How do I share there?
I think you're ready. There.
Okay. And the next is the agenda.
Back up the agenda. So
Is Cynthia, are you still on the, are you able to give a brief update for Norfolk State?
I'm online here, but I don't have anything to update you from the School of Nursing. I am with the Department of Health, Physical Education, and Exercise Science at Norfolk State, and also I'm the director of the NSU Center of Excellence in Minority Health Disparities. And some of what we have been doing with health disparities is going, into the community to talk about the effects of the social determinants of health, which one is, of course, housing, and going into the housing, public housing neighborhoods, and talking about the fact that, climate change with the sun and with the density of the housing, how that can pose a problem with the amount of heat coming, from the sidewalks and things like that, and how that can have an impact on health. We've been doing some things around, smoking and tobacco, and trying to influence people to stop smoking, because we know that that does also influence asthma and those kinds of health, chronic health, asthma and hypertension and things like that. But we, right now, the only curriculum piece that I know about is within our health education classes, where we do go into talking about environmental health, environmental wellness, what people can do in the environment to help keep the environment clean. We do have a student group that I do know helps with the Chesapeake Bay Foundation cleaning up, the Chesapeake Bay, which is has a great influence around our area. But those are the things right now that I know of that are going on. We do also, as far as the nutrition piece, we talk about, in the community, the fact that we need the fresh fruits and vegetables and getting away from the processed foods. And we try to influence and help those groups that do want to do, community gardens and things like that. So those are some of the things that we've been involved in with Norfolk State.
Well, thank you, Cynthia. I know you're on the education committee, and I just want to reiterate that we at VCCA are happy to help your students, your student clubs in any way we can. So we'll
Thank
take
you.
questions.
Oh,
Come on up. Oh,
You'll be able to see yourself.
Okay, wonderful. Hi, everyone. Again, Beth from Lay. I just wrote notes. There will be no slideshow. Which is, I really should have thought of that because we do have some really great photos of some of the things that we've been able to do. So I teach in the undergraduate program. I teach community health, which has given me a really great platform for this work. I tend to kind of like look at, kind of sweep over what I'm teaching, going, what's missing, what's the next thing, and what do we need to do to be one step ahead of public health trends. And one of the, it was kind of embarrassing when I realized we don't have as much with climate health and planetary health as really we needed to have. I didn't have a lot of barriers implementing this simply because I could position this as a social determinant of health, which I had really pushed for a number of years ago. In terms of like connecting what's really happening with healthcare outcomes, and what is actually happening to people and to communities. So this was sort of a no-brainer. But like everybody else, there's always a limit of how much time we have. Teaching community health, I've got 2 credits, so it's a tight timeline in terms of what I want to communicate with students, and especially where if this is something they've never really thought of or heard of before, because there's that whole introduction of it. And so I thought, well, okay, so easy ways to do this is an implementation of a program that's already out there. I added that Eco America Climate for Health program. It's self-paced, it's online. There's a certificate of completion at the end. So people have something to put on their resume, have something to show for it. And it includes, it comes from an environmental justice standpoint, which is very aligned with my own teaching style, and includes how to be an advocate. So it walks people through how to write a good letter, how to speak to a politician, how to speak to somebody else. And it does a really good job with staying apolitical, which is really, really important. And then the other thing we did within the community health curriculum was we added this green walking survey. So students can actually go out as individuals or together and just walk around our School of Nursing and go, hey, what is our lighting like? Where is energy being used where it doesn't need to be used? And they uncover quite a few deficits. So now, working on that with facilities is a whole nother thing, because sometimes replacing things with green lighting is such an output of cost. So there's where we kind of get some barriers. We were also able to work with our facilities people on an existing grant and get not only nursing students, but Health 101 students, who are talking freshmen, in service learning courses, to come out and plant a whole lot of trees on our new Virginia Beach campus. There is, Virginia Beach, it's in a water basin. We know that runoff is really bad. We on our campus had a lot of runoff, so planting those trees directly, it's a direct action. So that was really exciting, and students really benefited quite a bit out of that. It was really fun to see how the students react, their engagement, but also a news crew showed up, and we had, darned if we didn't have a nursing student who was able to very eloquently speak on the benefit of trees, not just for runoff, but the benefit of trees to our health as an antidepressant, as a cooling agent. It was spectacular because we had not prepped her, and she was amazing. So, you know, it's like, oh, they're listening. So that's really exciting that we got to experience that. We did also evaluate the new curriculum elements to see what students felt or thought about it, and it was so positive. We did write a little short article that's just been published in Nurse Educator as a way to communicate to other nursing programs that you can do this. It's not hard. It's very doable and feasible to put in to an undergraduate or graduate program. We were also able, the students actually got so excited about that 3 of them we helped them do a poster presentation. They were able to take that poster to 2 different national presentations, which were attended by not only nursing students, but by nursing educators. So that's kind of a way to get word out there that this is something that we can do, and it's something we should do possible, even when you don't have, say, a lot of institutional support, that you can align it with the AACN essentials and get it done. Let's see. What else have students done? We did have a few graduate students come to the VCCA day for advocacy. And I think that that's something that we will really try to organize better and have undergraduate as well as graduate students and kind of do some of that prep work. We definitely do some advocacy work and take students to advocate, say, for global funding every year. We go see our representative and our senator in the area. So this would be another thing that I think we could do in the spring and kind of build that a bit. As far as our faculty, we are really working on putting out some publications for integrating this kind of curriculum into nursing programs, and also things that nurses can use as sustainability, like sustainable actions through either practices or hospitals, things like that. Janice Hawkins wrote the A through Z, green is for green lighting, that sort of thing. We've also put out a couple of other just small publications that are to help people understand how to integrate this work. A couple of Eco America blogs. We did just do a podcast with Nurse Educator, which was a lot of fun. That podcast should be published in July. So it's another way to just talk about, this is how we can integrate this. This is why it's important, and hopefully get more nursing schools on board. Because I think that that's just the way we have to do it. If this is all just a known thing to doctors and nurses and pharmacists, if we just all know this, it's going to change our practices naturally. So that's kind of our focus. I was accepted into the Erie NCS this year. So that will include some research and science work, which I'm really excited about as well. And my focus is going to be on, of course, food systems and environment. So I was really excited also to meet Dr. Kawani. I think for our next steps is we do need to establish a better student organization presence in collaboration with Annie, who I'm a member of, but we could definitely work with our Student Nurses Association and do more work there. I was able to secure a small grant from 3M Littman that is positioned for developing nurse leaders in with a focus on climate climate preparation, disaster preparedness, and that will also hopefully include some sanitary health information. I am going to try not to go on forever, but thank you. I'm so glad to be here and hear what everybody else is doing. I'm gonna turn it over.
Well, thank you, Beth. And if you haven't had a chance to read her paper on how to integrate climate into the nursing program, it's an excellent paper. And again, as she sort of said, if we all knew this as health professionals, our voices are among the most trusted voices when we advocate for anything. You probably learned that in school. And advocacy is important because we really need to turn this ship around, and as quickly as we can. And the more voices and the more people who are educated and passionate about that, we're more likely to be the energy behind turning it around. Our last student update will be from Tori from WVU. And she is, again, a student advocate who's driven a lot of change at WVU. She also leads or presents at our journal club and leads our journal club, which we have during our monthly education committee meetings. All are welcome to do that or to attend. It's by Zoom. And again, so Tori, you're a rising fourth year now, is that right?
Yep.
And she will update you on WVU. And are you able to share your screen or?
Let me try. I think so.
Okay.
Are you seeing my screen?
No. Yes. Yes.
Okay. All right. So as Dr. Snow said, I'm Tori. I'm a incoming fourth year at West Virginia University. So I'll just share a little bit about some of the things that we've done as far as climate change efforts and sustainability efforts at our school over the past few years. Okay, so just in general, our state, West Virginia, is not necessarily the most climate friendly. So there's some stats if you're interested in looking at them, but this is some information that we've presented to some of our administration over time, just about how we really need this as part of our education and part of our curriculum integration. So as you can see, we're ranked like consistently 49th, 50th in national surveys that deal with climate change and sustainability efforts. And that has a lot to do with several factors: coal mining, just a lower average income, and then just relative low education levels and skepticism towards certain science and climate change throughout our state. So I figured go ahead and just share this picture. If you haven't been there, it's at New River Gorge. Definitely would recommend it. It's really, really pretty. It's about an hour from where I live. And in a place that has such beautiful environmental areas, that's even more of a factor of why we need to preserve those areas and focus on climate change. So before I started, we did have a little bit of climate friendly efforts. There are some specialty tracks at West Virginia University, which are interesting. There's a global health track. So in addition to the traditional medical school curriculum, they will do a few extra like projects and lectures over the summers and have some requirements there. And then they'll do a global clinical elective as well. And then there's also the culinary and lifestyle medicine track, which has focus on nutrition, healthy lifestyle, healthy diet. And we also have a sustainability coordinator at our Health Sciences Center, which surprisingly we didn't even know about when we kind of started our efforts here. But in general, there really wasn't much climate centered organizations or focus. So we reached out to, there was a small physician organization at WVU. It was like maybe 5 doctors at the time, called Mission Green. And I reached out to them about starting an organization. So this was back in 2020 and 2021 is when we started kind of building the foundations of having a student organization. That's our faculty advisor, Dr. Swapna Gayam. And we started our organization in 2021. It's called EnvironMed. And we just have basically the same goals as every other student program that's spoken so far. We've had a couple successes, and we've also had some hindrances, some fallbacks, and some struggles, which I'll mention later, and would gladly, take your advice. But we've done a couple of things that were throughout the years, mainly student-led projects. We've done a couple of repurposing projects. So one being taking sterilization wrap from ORs and repurposing it into sleeping bags and donating those sleeping bags. So it was one of our first projects that we ever did. And that was during COVID, so it was kind of difficult to coordinate. And we've done a couple fundraisers as well, mostly in benefit of our local organization, Friends of Deckers Creek, which just maintains our local waterways in Morgantown area in West Virginia. More recently, we have been working on a garden project. So we obtained control over these garden planters outside of our health sciences center. There's 5 planters, and last year was our first summer doing it. So we're just starting this summer as well, where we have planted several seeds, vegetable seeds, and then we donate the produce to an organization called Pantry Plus More that helps supply families in need with fresh food. We've also participated in the Planetary Health Report Card, which several other organizations have mentioned, and got a climate change to healthcare elective started. So luckily for us, we got the Planetary Health Report Card in after we had started the climate change and healthcare elective. So that made us look a little bit better on paper than we maybe really were. But it still wasn't the best Planetary Health Report Card results, as you can see. We had a highest rank of a B, which was okay, student-led initiatives, but that was kind of one of our downfalls, was that a lot of efforts that we have are student-led and not necessarily fully supported by faculty involvement. But yeah, overall, not the best ranking there. I just have a couple of pictures and links as well. So this is just the planters that we have outside of our health sciences building. There's, I think, 4 of them there. There's another one that we have access to as well. So that's what we've been working on over the past 2 summers. And then this is just a little bit about the course that we have available, the climate change elective. It's a 2-week course. It's offered virtually. It's only offered to 4th-year medical students. So overall, we still want to work on integrating more into our core curriculum, but we do have the elective option as an available option. It's heavily based on the elective that's already available at Emory University. So I found this link very helpful that just outlines their climate change elective course, and there's 17 free lectures that are available on that website there. So if anyone's interested in kind of proposing or figuring out what you might need to include in a climate change elective, I think that was really helpful for us to kind of get our footing in and propose an elective. And then we also just took some inspiration from UVA, and we wanted to have an advocacy day where we went and talked to some of our West Virginia state senators and representatives. So we didn't necessarily know what we were doing, but it turned out to be way easier than we thought it was going to be. So definitely would encourage that if that's not something that is currently active at your school or your program. All we really did was just figure out who we needed to call and call them and ask if we could set up a meeting on this day and figure out, if they had any availabilities. It was actually pretty easy. We got 5 meetings in, all scheduled on the same day, which maybe we lucked out a little bit. Maybe it will be harder than that in the future. I'm not sure, but I was fairly surprised about that. And then if you are looking to see what kinds of bills you might be interested in supporting or discussing with your local legislators, this link that I have here from Eco USA was really helpful for us because we weren't super familiar of like West Virginia climate related organizations in general, just because there's not that many. So using that link, it showed us a lot of West Virginia climate organizations that we could reach out to and ask them about their opinions on local or on statewide bills that were coming up and being discussed. And that was really helpful for us to kind of make our selection of things that we wanted to talk about. And that has links for every state. So if you
are interested in looking for other climate organizations in your area, that was really helpful. And we really stink at taking pictures. So we didn't take a picture with any of the people that actually went to this event, but there's just a picture of our Capitol building that I found off Google. Okay, so lastly, just some of the shortcomings and obstacles that we've kind of had along the way. And of course, I feel like I've already learned a lot through just everyone else's presentations about things that we might be able to incorporate and kind of use in the future. But in general, some of the curriculum integration has been difficult getting things into the core curriculum due to things that people have already mentioned, just getting it into the curriculum and making it, a priority enough to kind of compete with other topics that really need to be incorporated as well. And then just some lack of comfort in teaching the material. So some of our faculty had expressed that they just don't feel like they're an expert enough on the topic to actually want to discuss it or teach it, which I think is, a valid concern, but also like if we don't get the conversation started, how can we educate ourselves? There's also just a bit of a lack of communication that we've had between our hospital system and our medical school and our nursing school as well. We've reached out to nursing as well to try and get like some involvement from them. And it's just been a bit of radio silence. So we really haven't gotten very far in that. And then, so as I mentioned, we have a sustainability coordinator for our health sciences center, but we do not have one that we are aware of for the hospital that we can actually communicate with. So that's been very difficult. And like I said, pretty much everything's been student-led for the most part. So we are struggling with making sure we have enough involvement in the upcoming years. There's just been overall declining student interest, and any ideas that you have to kind of increase and ramp up interest, we would absolutely be all ears for that, because we've been trying to get some involvement and it's been a little bit difficult. And we have some meetings coming up just about discussing climate curriculum integration further. So that will be within the next couple months, and hopefully that will, advance our climate education a little bit more. And I just wanted to plug one more thing. This is coming up on the 28th. It's at 7 p.m. and there's going to be a virtual climate change event on creating sustainable change into medical school curriculum with climate integration. So hopefully that will be helpful as well. I will be attending and I would hope to see you all there if you're available. And that's all I have.
Well, thank you, Tori. She forgot to mention that she also attended the Virginia at C-Day and as one of those people in that. So again, thank you. Well, I'm now going to open this up to any questions for any of the speakers. Again, we're going to talk about sustaining interest, which you brought up, and how you keep continuity. And I think that's a major interest where we have faculty members who are advocates. It can help. You mentioned your $200 funding for a year. That'll support one pizza night, I guess, right? And so it's hard to bring people out. And also these times you have lots of conflicting interests. You have the interests you have to do for school. You have, pardon?
Are you ready?
Okay, yes, go ahead.
So I guess my question, I'm going to reach out to the students that are here right now. Can you talk to us about what brings you here today? What brought you here today? Who did? What's your interest? And how you think you can pass on your interest to those behind you?
So how, because I know you guys keep saying like nursing students, how do you guys like want us to incorporate, I guess all of this into our curriculum? Because like we take nutrition, like just two courses. And I know like for me as a transfer student from TCC, from a community college, I live at home. I never lived on campus, so I never got like the hands-on. I do know that they like ODU on their main campus, they do have a garden. They do grow fresh fruits and vegetables, and they do
have a pantry where they take those fresh fruits and vegetables and give them to their students, but they have to sign up for them. So how, as a nursing student, like, how will we incorporate that into our curriculum if we're only taking, doing nutrition classes? And our 2 nutrition classes don't incorporate climate control and all those other things.
So I think it goes through all of the programs, from certainly in pediatrics, my area is in pediatrics, certainly in pediatrics, from air pollution to social determinants of health to environmental justice, where kids live, what they're breathing, what they're eating, all of that. And so it isn't just one course. But I think the answer to that mainly is the faculty are responsible to that. The faculty, the dean, those who are in charge of writing your curriculum.
Because I know, like, for our main focus, what we've heard at ODU, while like attending nursing school for almost a year, that they have like tried to bring in like social determinants of health. And that has been like taught upon us since like we first started class as an ODU nursing student.
Is that a separate course or is it incorporated?
It's
like, when they're
incorporated.
talking about asthma and.
Right. So it's incorporated. We just started Peace this summer, so I don't know how far they will talk about that with the children. But I know for like our adult health or med surg, our first one, or even before then, when we were doing health assessment, they talked about a little bit about social determinants of health.
And are your professors comfortable talking about that?
Mm-hmm.
And how did they start doing that? Did the pressure come from above or did it come from students from below, or do you?
See, I'm not for sure. I know when we
The
started.
history on that.
Okay. Go ahead.
So, gosh, and I can't remember what year it was. I got a CDC AA grant, and developed social determinants of health curriculum that I then infused inside of community health, and it was not anywhere else in the curriculum.
And so it was, but you had to even pay attention and be aware that that grant was out there.
Oh, well, yes.
And
I had support from my chair at that point, who really understood this, and worked with like a really good team. And I will say, as when you're working on faculty, sometimes you present these things and people go, wait, what? Because for a long time, and I know that this has existed in medical school too, is that it's lifestyle and genetics. That's what makes health. But what we really know is that it's social determinants of health. Like, it's where we live, it's what we have access to, it's the quality of our care.
Determines your
It's
longevity.
way bigger. It's way bigger in a percentage. So slowly over time, there's been a lot of buy-in, and it's just, I think it's just showing up and keep talking about it until it sounds normal and not fringe. And so I was really excited that faculty from the first year, so I get, they just met me. Don't worry, you're gonna get all of this. So in that first year, it's been really exciting to see social determinants of health and the assessment of patients in social determinants of health in their first year, and going into the hospitals with that in mind. I'm so thrilled that this is starting much earlier and that they're not getting to their third semester with me and hearing this language for the first time and going, that's not what we've been taught, so it's great.
And I'll just say from the graduate perspective, I teach a population health epidemiology class. So that course has been guided, I think, but there are also a lot of overall national nursing documents, or, Institute of Medicine report, Future of Nursing, that came out there. The American Association of Colleges of Nursing, which credentials us, also came out with competencies, and social determinants of health have been and continue to be a big part of that. So it came from above as well. And so there were a lot of guidelines that came out and a lot of information that came out. So, in the graduate school, it was part of the doctoral program, but we made it part of my course is now part of both the master's, all masters and doctoral students have to take it. So it's it's a key foundation, and it's in their very first semester. So it's a key foundational piece, and it's a thread that's continued on. And we've been doing that since 2012.
Yeah, that's wonderful. Yeah.
How do these bodies integrate climate change into social determinants of health?
I think it's being incorporated more now. I think in the past it wasn't, but now, there's so much research that's come out that said it is a key part of all that. So it does influence it. I think, in terms of like the American Academy of Nursing, there's a special interest group and they have policy statements that have come out, and climate is now in the last 2 years a key portion of that. And, there are a lot of national organizations that have started to put that more at the forefront, but that's been more recent. So
Are there any questions about climate change in any of the exams, the national exams, accreditation exams?
You guys want to know this.
Well, because that is, as somebody said earlier, that sort of changes. If there's a question, that changes how people study, focus, look at, and talk about.
On the certification board for the American Association of Nurse Practitioners, and they do integrate it, but indirectly. I mean, it's really more clinical. It really is. There are 2 credentialing bodies, and I think the ANCC has a little bit more. They're not quite as clinical, and so there are some questions on that one. But no, not really. There need to be more.
Yeah, I think, going back to your original question, how do you get, this, getting into the curriculum? I think all parties have some, power and responsibilities, and a lot of times looking at the development of many of the schools, it's when all the elements sort of come together where you have a lot of traction to move forward really quickly. So, from the student standpoint, we've seen a lot of grassroots efforts, and I think even as a new student, you do have the power along with your peers to, gather information about the assessment of needs and demand a change for the school administration. And then from the faculty standpoint, we have faculty champions that have, gotten this forward, whether it's, our keynote speakers from New Jersey or many of the faculties in our medical schools and school of nursing. And then you certainly need the curriculum committee, the administration to be supportive, and then certainly getting the toolkits that are needed from national organizations, and in time, perhaps more of the curriculum, input from national bodies that would actually make this a little bit more formalized. So I think all parties certainly have a role to play.
And to that, Homan's comment, it's interesting to contrast VCU and UVA in terms of their medical school programs, because both had very active students when I joined VCCA, student groups. But Lena was able to contact Homan and Sam to get as coordinators, teachers of an elective at UVA, whereas VCU couldn't identify a faculty member, and so as you've seen, is almost starting over again. And so students can push that, but you need to have a faculty members who are part of that continuity.
And I would say the good thing is, as this work continues, all students eventually can and do become faculty. We may have to wait until you're a faculty member to push this forward a little bit more. But it is true that our incoming generation certainly has more energy behind this, and I think in time, all these efforts will move forward.
One of the rules of VCCA is we have access to speakers, to professors, to who may not be at that in institution, but can at least bring lectures in and start the process.
Yeah, I think that's key, because I'm looking at ODU, you've got student interest, you've got the faculty all there, you've got everything. And the faculty can hold on to the younger students, but the students who are becoming more senior can go back and say, I want to pass this on to a younger student. So I would invite you to definitely do that, but the thread can be VCCA because we're not going away. We're staying. So that's the thread, but you can see how powerful the role of the student can be in all this.
And we have had some students, nursing students go back and teach Health 101 students. I failed to put that in my update, is that we did have senior nursing students went to Health 101 students and talked about how to be a climate activist or advocate.
Right.
And all of that connection between climate and health. It's absolutely really available.
I wanted to throw in a slightly different perspective to this. I'm wondering what we would possibly accomplish and learn if we look at something a bit more fundamental and understanding with the education and implementation of climate and health things by going to the agencies that generally control these things and the politics of it. Now, it's understood that there is a climate concern, but the immediate effects of it are normally seen in disadvantaged communities. So I'm wondering whether we're shifting our perspective to the faces of the immediate impact, whether how that may begin to affect how the policies guiding what is the curriculum. For example, in Virginia, the State Council for Higher Education in Virginia has its 5 competencies, and one of them is health. So if we go to that conversation where fundamentally in educating the system, this becomes something that doesn't happen to the undesirable, maybe that might begin to shift how we even approach it overall, because it becomes a collective consciousness that you're only as good as you've taken care of your brother, your neighbor, your next person down the line. Before we even get to this sophisticated dialogue, how do we get these things in this particular area? So there's a baseline that I don't know whether we've actually been sensitized to covering and even understanding. Because I heard something about disseminating information. How about the fact that there's a basic illiteracy, that whatever you disseminate cannot be read? Talk about understood, and therefore to even go there. I'm sure the clinicians there have tales of people who come in and can't tell you what's wrong with them, but they know that they're sick. They can't tell you what it is. The language, they don't have the basic education to do that. So I'm just thinking.
I mean, I agree. We as health professionals can advocate for those people in words that they may not be familiar with. And that's why I think one of the reasons I'm interested in this is the health voice, and training advocates. Everybody who comes out of a health professional school should be advocating for their patients in every way they can, which includes at the bedside, but also politically, and saying that these people are suffering from things, from where they live, from the lack of quality food, from climate change. And so I don't know whether that answers your question, but that's how I feel that I can best speak for those, people.
That's a good question. The things that are conscious, I can do so.
Yeah, anybody else want to address? Because I think it is an important concept.
I think that if we look at some of the community outreach we do as part of health schools, that kind of ties in. We definitely need to keep anything that is printed or written. We have to keep that literacy level really at that 4th grade level. It's easy to check. You can use Word to help check literacy level, but also really being able to get out and talk to people and listen to people and hear what their barriers are. And then we can only do that by being in community. really, and that's it. And so oftentimes you go out to do one thing and you realize that what you're really doing is teaching on it, a whole other thing, because somebody wants to know something else. That, you know, if we're working with our food bank and we're doing food distribution, people go, well, what do you do with this? You know, and that can kind of spur in other projects, and other ways to interface with community members. That's a lot.
I was going to say, I agree with everything that's just been said. I also think it's also important to remember the importance of representation. And so, you know, going out into respective communities, you know, there's as we all know, a distrust. And so, in order to get that buy-in, that's a consideration that needs to be highly prioritized with regards to the importance of the providers. I know, I think one of the earlier presenters kind of touched on that a bit, and kind of some of those things in regards to just the discipline at large, the healthcare discipline at large, and how that's a major barrier. So in initiating these conversations and, you know, being able to take this information back, I think that's an important factor that has to always be at the forefront of individuals.
Yeah, earning trust.
So having that dynamic that is diverse even amongst the teams.
I think we look at cultural diversity, but we don't. We learn it in text, but there's a big difference between what's in text and what is real. Just like with me and my patients, I have a glass full and I put my salad in, they all know I eat salad. So they see it every day they come in. And so they know that this is not just me telling you to do something different that I wouldn't do. On some of my patients I do walk appointments with, I'm not really sure I'm supposed to, but I encourage walking, I encourage these things, vitamin D, I'm gonna give you a pill, I can take you outside. So these are some of the things that I do, so they trust that they see me doing it, so they trust me. It's not something that I have to sell. And I think that's the part of when you're in the community. I think culturally, to speaking from my culture, it's looked upon as you're here looking down on me, telling me what I need to do. And so it's gonna take me some time to really say, okay, yeah, that's good. But if you see somebody doing it, especially that looks like you, and they're okay, you come to your appointments, they're still here, you know, it's okay to eat this stuff that looks like grass, you know, it's okay. I get that, I said, that looks like grass, I'm like, well, let's just try it. So I do eat grass, I do that, I'm like, I'm not even eat grass. So there's things they just haven't been accustomed to. You think about when food stamps first happened, everything was in the middle aisles. You couldn't purchase anything from the outside aisles. And so that's what they're accustomed to.
Yeah.
If you're gonna get full, you're gonna get full from the inside out. So you're not gonna get full from eating a salad. For some people, if I have to feed 5, I'm feeding from the inside out. And I understand that. So I think it's that part of the education piece that we're missing. It's maybe that they don't want to do it, they just don't know how to do it. And they have to trust whoever's presenting it to them so that they will feel comfortable in doing it.
I just want to add, I think that we got to read the room as well. So your patient comes in and they're having a problem. And you have in your mind, I'm going to give you this information, but that's not what's on their mind. They might be thinking about, I don't know, that they haven't eaten today, but you know, you have to read the room and find out what the patient wants to talk about. And then, yes, we have to get that information in, but you can feed that in slowly and they'll take it in better and understand it better once you get whatever's on their mind out of the way.
Yeah, that reminds me, when physicians listen to a patient's complaint, it's like average or less than 17 seconds before they were cut off. So I think listening and gaining trust and understanding the circumstances are critical. So.
So in regards to more experiences in the classroom or students to experience using this in regards to research or what that looks like in practice.
Yeah, so the way we have undergraduate nursing structured right now is we have that classroom didactic, and then we have all of you with clinical groups in community with really it's very cultivated, partnerships. And so, much of that in community is, student-led. It's based on what you're hearing from the community and what, and as well as what your interests are, so that you can kind of find something that really aligns well. Do you have something you want to offer? Rudy was.
So I had the wonderful pleasure of taking Dr. Blue's class when I was an undergraduate student. And I'm finishing up my doctorate now, so I'm like, the ODU, I've been at the school for quite some time. And I've learned some of the like different changes, seen some of the changes. But like you're asking, one of the things that I did was we went out and assessed the community. And we went out there and we met the community and we assessed them in a way and we asked them what they needed. So we took what they answered, like their answers for us, and we developed a program. We were at the Boys and Girls Club and there was a need on exercise and nutrition. And we saw most of the students who went to the Boys and Girls Club after their like days at school, and they weren't getting physical activity, and the snacks that they were getting were not very helpful. So we developed a program that showed them, you know, how much water should they drink throughout the day? What are healthier alternatives for snacks that they could use? And then we actually created like an obstacle course to get them out there, and their prizes were like an orange or something more, you know, something to get the students out there. So it was really interesting as a person who was just getting into nursing and seeing that I could have a positive impact in that sense, like getting out there, assessing the needs that the community needs, and then coming up with a simple path to improve the quality out there. And now I'm in the doctoral program and I'm an ODU community care scholar with some of the other students here. And we're out doing community work as providers now. And we're going out on mobile clinics, and we're in a clinic at a homeless shelter or a homeless resource center. And we're seeing these community care needs. And I think it's interesting coming to VCCA and seeing the different things that are being addressed as far as climate change and seeing how it affects these populations. We're in rural populations, we're in urban, underserved, homeless populations, and now we're gonna be in a different area. But it's interesting to watch and hear how the climate change can affect these populations. And address the social determinants of health and like put it all together.
I'll just add to what Blue said. Dr. Tremblay has done a beautiful job at how she's each year the course, the Community Health Course has developed, it has expanded. I facilitated in her course over our ODU cares, our serving our underserved, our homeless population in the Virginia Beach area. And our mobile health and our HRC, our newer clinic. But what the feedback that I've got from the students who had these experiential learning opportunities has been, from their vantage point, life-changing for them in their practice. And they're ready to now move forward and take these into their independent practice as they're preparing to graduate. And they've all come back and said at the end in their reflective writing is that they wish the inpatient acute care nurses were able to come back and have these learning opportunities. It's transformed how they see individuals, how they see healthcare, how they want to enter into the discipline and the impact that they want to continue to have moving forward. So I think a great foundation has been laid, and we're really proud of how it's just, they're more conscientious of how they want to influence not only their patients, but the community at large. And so I think that that's something that's really, really wonderful. So thank you for that.
Oh, thank you. It is a team effort.
Yes, one last question.
Oh, it's not a question, it's just I've been having my hands up like 3,000 times.
Okay, so I do work in the community and I know I heard mostly everything what everyone's been saying. But one of the major things that I see about my patient and what they tell me when I go into their homes is they don't have most of their providers listen to them. So as okay, so I don't know, not every one of us is a provider, but if you meet anybody as a patient, the first thing I will advise is listen. Let them ask them about what they know, especially when they have a diagnosis or when they knew about the diagnosis, what they know about it, and you can build on it. So I think that will kind of build a trust and relationship. So they will be able to be like, okay, so this person is really interested in me as a person. Not like, okay, so you have this, and most of them don't really even understand the diagnosis. So, but if you ask them about the little or any other thing that they know about it, then you can be able to build on it, and then you can be able to explain other things to them, because that's kind of like how, my opinion, how we can like build on the community and by listening and being able to give them information so that they can be able to take better care of themselves, like kind of like making informed decision, like, okay, so I know about this, so I can work and strive better, and for us to kind of be a better example as well.
Yes, without listening and trust, you won't get buy-in, and if you're talking to the patient while you're doing that.
Oh, yeah, we do that a lot.
That's hard. So I think we're gonna break for lunch. We'll continue this conversation and have some handouts and worksheets after lunch. So it'll be,
For folks online, they want to join back.
if you wanna, yeah, probably 20 after. You think that's reasonable?
Yeah, so like 120 or so,
120.
get folks to settle
Back in, if
lunch.
you wanna come back in, yeah, we're gonna get settled for lunch. We can, I think, bring it in here and eat.
For the on-site folks, we're gonna do a quick group picture right outside, so we'll do that before we grab some lunch.
Okay.
We're doing that first. Okay.